Fibromyalgia syndrome, or FMS, is a chronic pain disorder that affects millions worldwide. Characterized by widespread pain, fatigue, sleep disturbances, and mood issues, it can be challenging to diagnose and manage. Most patients are women, and the exact cause remains unclear. Diagnosis relies on clinical criteria, such as the Widespread Pain Index and Symptom Severity Scale, after ruling out other conditions. Living with FMS means dealing with persistent symptoms that impact daily life, making effective pain management crucial. In this video, we'll explore how patients in Germany are currently treating their fibromyalgia pain, what medications are used, and how effective they really are. When it comes to treating fibromyalgia, guidelines differ across countries. In Germany and Europe, there's no officially approved drug for FMS. The German S3 guideline and European recommendations suggest temporary use of amitriptyline, duloxetine, and pregabalin. In contrast, the US FDA has approved pregabalin, duloxetine, and milnacipran for fibromyalgia. Canadian and Israeli guidelines also recommend SNRIs and anticonvulsants. Importantly, all guidelines highlight that non-drug therapies like aerobic exercise or cognitive behavioral therapy may be more effective and have fewer side effects than medications. Let's see how these recommendations play out in real-world practice. Understand medication use in FMS. Researchers interviewed 156 patients at a German neurology clinic. Most participants were women with a median age of around 50. Patients were carefully diagnosed using established criteria and screened for other conditions. The study also considered subgroups based on nerve fiber density, aiming to see if this affected treatment response. Patients reported their current and past medications, reasons for stopping drugs, and rated pain relief on a numerical scale. This comprehensive approach helps reveal not just what drugs are used, but how well they work and why some are discontinued. Among the German FMS patients, nonsteroidal anti-inflammatory drugs NSAIDs were the most commonly used, with 41% of patients taking them. Metamizole was next at 22.4%, followed by amitriptyline at 12.8%. Opioids, both weak and strong, were used by only 7.7% of patients, reflecting cautious prescribing. Interestingly, 16% of patients weren't taking any medication for FMS symptoms at all. Many patients had tried several drugs over time, often discontinuing them due to lack of effect or side effects. This pattern highlights the ongoing challenge of finding effective, tolerable pain relief for fibromyalgia. Way FMS patients take their medications varies. Over half use painkillers on demand, meaning only during pain attacks. About 35% take their drugs daily, while others follow different regimens. NSAIDs and metamizole are mostly used as needed, while antidepressants like amitriptyline and SNRIs are typically taken every day. This flexible approach reflects the unpredictable nature of fibromyalgia pain and the need to balance relief with potential side effects. However, only about 30% of patients actually follow the recommended drug therapies from guidelines, often due to previous negative experiences with these medications. How well do these medications actually work? Patients rated their pain relief on a scale from 0 to 10. NSAIDs and metamizole provide a median pain reduction of 2 points, while amitriptyline and SNRIs offered about 1 point of relief. Other drugs like opioids or pregabalin were used less often and showed similar modest effects. Many patients discontinued drugs like acetaminophen, flupirtine, and SSRIs due to lack of efficacy rather than side effect. Overall, the pain relief achieved was moderate at best, highlighting the need for better treatment options and more research. Key finding was that most patients stopped medications because they simply didn't work. For drugs like NSAIDs, acetaminophen, SSRIs, and opioids, lack of efficacy was the main reason for discontinuation. For others, such as SNRIs, amitriptyline, and pregabalin, intolerable side effects like fatigue or weight gain were common causes. This cycle of trying, stopping, and switching drugs is frustrating for patients and doctors alike. It also explains why so few patients stick to guideline-recommended therapies. Many have already tried and abandoned them due to poor results or side effects. Researchers also explored whether patients with nerve fiber loss, a possible marker of neuropathic pain, responded differently to medications. Surprisingly, there was no significant difference in pain relief between those with or without nerve fiber pathology. This suggests that, at least in this study, targeting neuropathic pain specifically didn't yield better results. The findings highlight the complexity of fibromyalgia and the need for more personalized approaches. Larger studies are needed to see if certain subgroups might benefit more from specific treatments in the future. In summary, managing fibromyalgia pain remains a major challenge. Most patients rely on medications that offer only modest relief, and many don't follow guideline recommendations, often because they've already tried and discontinued those drugs. Non-drug therapies like exercise and cognitive behavioral therapy may be more effective and better tolerated. There's a clear need for more research, especially randomized clinical trials, to find better treatments and to understand which patients might benefit most from specific therapies. For now, a flexible, individualized approach combining medication, lifestyle changes, and support offers the best hope for those living with fibromyalgia.